Hi, Dr. Saxena here, and this is something we are talking about about what are the alternates we have. In this segment, I just want to talk about what are the alternates when we work on some nasty problems. Yes, there are always some chronic problems which are done. They are nasty, and there is a big kind of question marks when we start looking into this. Why me? When the person starts asking me why me, and this is something which we believe is not a very straightforward answers we don't have when it comes to cancer treatment and all that. So let us explore what are the alternatives, cancer alternatives we have when we explore this particular thing. So this is one thing which is always being trying to haunt this one. Yeah, we are talking about how things can be practically any age cancer is trying to come into this one, and there is a constant relation between aging and cancer. This is overall cancer prevalence tends to increase our bodily abilities to function and repair because of that becomes increasingly compromised. So there is a correlation with the aging. The more you age, you may have likely chances of getting into cancer, and there are some strategies like anti-aging strategies used to improve and maintain function and repair, and this is also can be taken as anti-cancer strategies. And what I am really going to talk about is something called integrative cancer treatment, which is what is this integrative cancer treatment? Is a unique therapy for treating individuals with cancer. This comprises of multiple areas. We try to use off-label pharmaceuticals, nutraceuticals. You get vaccines, types of immunotherapy. You have novel drug substances not yet approved by FDA or dietary treatments. And apart from that, we tend to use a lot of something like mind-body medicine and something like hyperthermia and other things. So this is a 360 degrees approach. What we work on this, and we normally this is something which I always try to make very clear. He is the very late advanced stages. What are the things which have been talked about? Is when you are looking at the traditional cancer therapies, it is very effective when you start early. For early stage cancer, it's very good, but unfortunately we have made very little progress in the current in the treatment of this advanced stage cancers for the last 20 years. So these things are this I just want to share this particular thing. There are clinical trials. The others, one of the medical oncologists and two radiation oncologists analyze the results of all randomized control studies trials which was held in Australia and US, and this was a 5-year survival rate which was this is a statistically increase in 5 year survival due to use of chemotherapy. Conclusions were following. Contribution to 5 years survival in Australia was 2 to 3%, and the contribution to 5 year survival in US it is 2.1%. We are talking about RCTs performed in US and Australia, and these are all the advanced stage cancers, and this study was already published in the British Journal as well. This is Clinical Oncology 2004 December. So this paper was the contribution of cytotoxic chemotherapy to 5 year survival in adult malignancies. So based on this particular thing, we believe that there is a need for an alternative. See, the thing is, with all sorts of improvements, your median survival in lung cancer case is hardly increased by one month in the past 20 years, and overall survival benefit of less than 5% has been achieved in adjuvant treatment of other breast, colon, and head and neck cancers, and so this clearly indicates there is a need for alternative. And what are the alternatives? What exactly I would like to present And the way I look cancer, I can always tell there are something like three stages in cancer. I'm not trying to do a staging of this particular thing, but when I talk about this particular stuff, I'd like to show you the initiation, promotion, and progression. Initiation can be thought of as planting of seeds, and promotion can be thought of as watering and fertilizing the seeds, and the progression can be thought of as continuation or non-stop proliferation of the same process, transforming or destroying everything which comes into contact. So these are the things, if we can understand what is happening at initiation, what is promotion, and what is progression. So see, the question here when we talk about this in integrative medicine, integrative thing is how this can be halted. This progression from we are talking about initiation, promotion, and progression. So initiation also how it can be and progression, as well as initiation as well as this progression and promotion can be halted at simple ways. This stage can be we can do by two things. One is by cleaning the out toxins, and second one is stop watering and fertilizing. So this is one thing which I always try to tell. Okay, this is a when you compare with a conventional oncologist, he finds out there is a burglar in the kitchen, so he throws a hand grenade in the kitchen. And so what is the integrative you take? Integrative, you find out there is a burglar in the kitchen, and so we inject some poison into a mosquito and send to the kitchen. We feel very strongly that it's important to keep the kitchen intact. We also want to know that even if a burglar escaped through the open window, having been bitten, he will not survive very long. So this is the kind of thing which is the integrative approach, and this approach has been we are trying to work on the cancer physiology, not just into the kind of what William Halsted was showing. Modern oncology relies on theory of William Halsted, and his focus was not only on the tumor and not on the cancer physiology. It's the cancer physiology which creates and maintains cancer. So the key to effective cancer treatment is both to kill cancer cells and to reverse the cancer physiology. These cells are usually destroyed by a healthy immune system, and so this is the big thing we need to understand. And at the same time, what exactly is causing cancer we need to understand is I can always tell you, I'm trying to work on this particular model. I can always tell you it's a cellular oxygen deficiency, it's a long-term nutritional deficiencies, you have got a lot of metabolic toxins, you have got heavy metal toxicity, you have got environmental exposure to all these things, you have medications, you have genetic predispositions. Apart from that, you have somebody with negative psycho-emotional balance. These are the some of the causes which develops into cancer. See what you look kind of thing, it's already 7 to 8 years each. And see, when we talk about this particular thing called cellular oxygen deficiency, I want you to understand about what is happening with the cancer metabolism. Cancer cells are metabolically primitive. They are no longer capable of using oxygen like all other cells in the human body when they burn glucose for energy, and are therefore greatly handicapped. See, this is one thing. They are primitive. That they use something like anaerobic metabolism. So this is one of the discovery of this cancer metabolizers anaerobically earned Dr. Otto Warburg a Nobel Prize in 1931. When the cell is deprived of 35% of its oxygen for 48 hours, it will likely become cancerous. Cancer cells may have other metabolic deficiencies, including lack of certain deficiency of critical enzymes such as catalase. So this particular thing, metabolism, we talk about cancer metabolism. Cancer metabolism, all the cancer cells, they metabolize by anaerobic metabolism, whereas the normal tissues and all, they metabolize by aerobic metabolism. aerobic glycolysis, what we call. So what happens with aerobic glycolysis? You have got some glucose, oxygen, and that gets combusted, and it releases something like 36 ATPs, which is a good energy and all that. Whereas in the case of cancer, which has got anaerobic metabolism, anaerobic glycolysis, most of the chronic diseases, they get into towards the anaerobic metabolism. And here what happens is that with the one glucose molecule, and because of lack of oxygen or inefficient, because of Warburg effect, what we call, you only get 2 ATPs out of one glucose molecule instead of 36 ATPs. And apart from that, you get abundant pyruvic acid and lactic acid. So there is abundant lactic acidosis and all that stuff which happens, and this results in a problem by which they start. There is a kind of the acidity increases, and there is a kind of big things which happen, which causes that anaerobic. There is a obligatory. The cell starts for survival. It starts division and starts depending on this particular stuff. So this is the particular basic scenario where we believe that this thing, oxidation, which we call it as a first thing I was talking to you about, cellular oxygen deficiency. The next thing we talk about a big way into heavy metals and all. Heavy metals is one thing which always is. We were talking about what is the heavy metal burden in cancer, and there are a lot of papers which have come now which suggest there is a big role of these heavy metals. What is happening? In fact, there was a paper which was breast cancer tissue, increased levels of transition metals, particularly you have something like nickel, you have got chromium, you have got mercury, lead, and even you had something like bisphenol, and you had something like parabens also, which was isolated from that tissue, which was toxicology studies showed these particular things. So when we have this kind of heavy metals inside, it is closely related to high free radical generation, lipid peroxidation, and you get into DNA adducts and all that, and this is how you get into problems. So this is one of the which we believe is the heavy metal burden is the major cause. And when we looked into the breast cancer cases with that this particular thing, we were able to see there is a significant accumulation of iron, nickel, chromium. You got zinc, you have got cadmium, you have got mercury and lead, and this not just from breast cancer. We have been able to isolate high levels of copper from human lung cancer biopsies, and high levels of iron and nickel have been found in patients suffering from prostatic carcinomas. So this is a big thing which we thought we picked up, and this high levels of nickel accumulation was a constant feature with a lot of malignancies, particularly prostatic and other biopsies. And this was apart from that, you have got zinc levels also were quite high, and it was we are still not sure why the zinc is getting accumulated into these tissues. And out of that, and it was not a surprise, mercury, we were always talking about mercury, and mercury was found in 11 out of 20 samples of the breast cancer patients. And it's difficult to explain how this mercury is getting into that. And the common thing which or other thing was a cadmium concentration were found in 18 out of 20 cancer biopsies. And cadmium is one thing which is one of the commonest thing which is right now we try to working on that. This is one of the big mercury, aluminum, lead, and cadmium is the big things here. And we are able to see cadmium into a lot of pancreatic cancers and some other most of the cancers, particularly when it comes to lung cancer as well as pancreatic cancers, you have got some high levels of cadmium which is shown. And they isolated something called lead. Lead also, it was isolated in 12 out of 20 tube biopsies. And there is a thing called hexavalent chromium, which is one of the main causes for lung cancer. It was the inhaled particulate matter forms of hexavalent chromium was found to be causing something like lung cancer. And this is one thing which we were not aware about this. And I do see a lot of increase in numbers of lung cancer, and mostly they are adenocarcinomas. But when we look into the toxicology sampling and all, we tend to find what is this cadmium, what from where this thing is coming. It's usually chromium or hexavalent chromium, or it's something like cadmium in the tissues. So this is one thing which we always talk about this. Cancer is a culmination of years of pathological reactions. So that is the reason we should always look into our priorities in cancer research and diagnosis to emphasize the disease beginnings rather than its terminal stages. We believe you need to work it out at a molecular level, and we need to work as a team, trying to look at biomarkers capable of signaling a greater risk of cancer. Yes, there's a lot of talk about DNA index and all that, and we somewhere as a kind of thing, there are some markers for gene activation. There are some markers for DNA and protein adducts. There are markers for DNA damage. We have got intracellular level of antioxidants is very important to. So what happens is that if you are having a deficiency of intracellular levels of antioxidants, you are more likely to get into some problems with this particular stuff. And see, I always pose this question, and I'll tell you, you and I can be exposed to exactly the same amount of chemicals, and our response will differ perhaps by 100-fold. And therefore the carcinogenic agents in the environment are more harmful to certain members of society than others who are similarly exposed. It has been estimated that in the absence of environmental exposure to toxic chemicals, cancer incidence would be reduced to by 70 to 90%. So I can always tell you, prevention of cancer is the best treatment. Avoiding this is the, you should always think of what is this prevention this doctor is talking about, and how we can always see that we can get away with these things which are really causing some problems. So you need to work on your physiology, try to optimize your physiology, try to see your some of the markers are very good. And yes, we can always tell you, you are likely to go into some things. There are some p53 genes, there are some cytochrome p450 molecules, and there are family of enzymes and which are important, where something like glutathione transferase, which is these are beneficial to. So when you are lacking, for example, there is a thing called GSTM efficiently detoxifies polycyclic aromatic hydrocarbons, which are emitted from the exhaust fumes and all, and ethylene oxide and styrene that are found in tobacco. See, these are all so many things you have to understand. There are, in the urban air, you have got an abundance of this particular thing called styrene, tobacco smoke, and you have got pH and all that. So if you have, suppose if you individuals who lack the gene for GSTM, deficiency can be consistently associated with the increased tendency to urinary bladder and the lung cancer. So this absence of this gene might be monitored as a biomarker for susceptibility to lung cancer and bladder cancer. So there are like that. We try to analyze. We try to know that if you are not having properly glutathione, intracellular glutathione levels, you are likely to get into some kind of problems. Having said that, I just wanted to show you how does you should understand what are the things which causes this oxidative reactive oxygen damage. And when we are talking about unsaturated lipids, proteins, DNA are the components of the cell that are most sensitive to the oxidative damage. And this protein, DNA damage and lipid peroxidation can end with something like membrane damage. They can end with something like membrane damage, altered receptor functionality, and eventually to cell injury. So most of the problem is caused by this reactive oxygen damage. What I mean to say by damage is this particular stuff, where I can always talk about this particular, and here we have a reason to say कि yes, I work on this. You need to see what is the normal membrane first, so that you will understand what are you getting after you with reactive oxygen thing. After the lipid peroxidation, the membrane which is like this, it gets into something like this particular stuff. So with this particular thing, we are trying to this is the lipid peroxidation, and which causes the damage to the membrane, and this is the key thing causing. So we need to balance this particular thing. If this cellular membrane is good, you will not get into any problems, and your cellular membrane goes into this, you are in for a problems. So this is how we try to work it out. I'll be talking in different segments, and I thought I cover up this particular things too first. For that, if you are having something like a membrane like this, and you should be careful in trying to work it out, and don't wait till you get some problems. Try to see that if you have this membrane like this, you don't have to worry about. Thank you.